Welcome back to the Deep Dive. We're here again, ready to cut through the noise and get straight to what matters.
That's right.
Today we're tackling a subject familiar, maybe too familiar, to many horse people.
Yeah.
Equine hoof abscesses.
Ah, yes. The sudden scary lameness.
Exactly. It looks terrifying, makes your heart sink, but often, thankfully, it's manageable. We've sifted through a load of vet reports, practical guides, the works for this one.
And our mission today is pretty clear. We want to arm you with understanding.
Right.
So you can quickly get why they happen, what the telltale signs are, how vets treat them, and maybe most importantly, how you can try and prevent them.
We want those aha moments for you, without the information overload.
Precisely. Quick, clear insights.
Okay, let's dive in. First things first.
Yeah.
What exactly is a hoof abscess? We hear the term, we dread it, but what's going on structurally?
Well, at its core, it's a localized infection. Think of a pocket, basically, a collection of pus.
Pus, okay. Where?
It gets trapped between the sensitive living tissues inside the hoof, the dermis, and that hard outer hoof capsule, the wall and sole.
And they're common.
Oh, incredibly common. I'd wager most horses deal with at least one abscess in their lifetime.
So if it's just a pocket of pus, why the extreme drama? Why the three-legged horse scenario?
That's the absolute crux of it, the hoof capsule. It's like a rigid box. It doesn't expand, not even a millimeter.
Okay.
So when bacteria sneak in and the immune system reacts, pus forms. But because there's nowhere for that fluid to go,
The pressure builds.
immensely. Even a few drops of pus create intense pressure on those super sensitive internal structures. It's like a hydraulic press inside the hoof.
Wow. Okay, that explains the pain level.
It really does. That rapid pressure increase is the direct cause of that severe acute lameness you see. It's why owners often immediately fear a fracture, something much worse.
So the body's trying to contain the infection, wall it off, but in doing so, within that rigid hoof, it actually cranks up the pain factor. That's kind of ironic.
It is, isn't it? So with all that pressure building, the body needs an escape route.
Right. It has to go somewhere.
Exactly. It seeks the path of least resistance. Often that means bursting out through the sole,
I've seen those little holes.
or sometimes it tracks upwards, migrating along the white line, that junction between wall and sole, and eventually breaks out at the coronary band, right at the hairline.
That's the gravel thing people talk about.
That's the old term, yes. And here's the proof of the pressure mechanism. The instant it drains, the pain relief is dramatic, profound even.
From agony to comfort, just like that.
It's highly characteristic. That before and after helps differentiate it from other lameness causes that don't resolve so quickly.
Makes sense. So how do these darn bacteria get in there in the first place?
Oh,
The hoof seems so tough.
It is tough, but not invincible. While you don't always pinpoint the exact cause, it usually involves some kind of breach, a defect, or an injury.
Like stepping on something sharp.
Absolutely. Puncture wounds are a big one. Nails, screws, sharp rocks, bits of glass, straight through the sole.
Ouch. What else?
Defects in the white line, maybe it's stretched or diseased, cracks in the hoof wall or the bars, even just severe bruising on the sole can lead to a blood blister, a hematoma, that then gets infected.
And horseshoe nails.
Yep. If a nail is placed too close to the sensitive tissue or actually enters it, that's a nail bind or a prick. Definite entry point.
But it's not always a clear injury, is it? Sometimes the environment itself seems to set the stage.
You're spot on. Environmental conditions play a huge role. Think about extreme changes going from really wet, muddy fields to bone-dry, hard ground.
Just constant wet.
Exactly. Constant wetness softens the hoof, makes it spongy, more easily penetrated. Extreme dryness makes it brittle, prone to cracks. Both open the door for bacteria.
Just general muckiness.
Poor, stable hygiene, standing in contaminated mud or bedding, that definitely increases the risk. It's just more bacteria around, waiting for an opportunity.
I read something interesting, too, beyond just wet and dry, about wind.
Ah, yes, that's fascinating research. Some studies actually suggest a correlation between increased wind speed and a higher incidence of deep subsolar abscesses.
Really? How?
The theory is that strong wind might actually drive tiny microscopic foreign particles into minute defects in the hoof sole. It sounds subtle, but it highlights how hoof resilience is constantly being challenged.
And higher temperatures might decrease the risk.
That was another finding, yes. Perhaps related to ground conditions or bacterial activity, it's not entirely clear, but it shows it's complex.
So beyond trauma and environment, what about the hoof itself? The horse's own hoof quality?
Crucial factor. Poor hoof quality, whether that's genetics or influenced by environment, is a big one. Thin soles are naturally more vulnerable to bruising and punctures.
And hoof shape, like long toes.
Structural distortions, definitely. Long hooves that flare, neglected trimming leading to imbalances, conditions like seedy toe, even severe thresh can compromise the hoof's integrity and create entry points.
And this links back to the horse's overall health too, doesn't it? Can recurring abscesses be a sign of something bigger going on?
Absolutely. This is a really important point. Think of recurrent abscesses as potentially a sort of barometer for the horse's systemic health.
How so?
Underlying conditions can weaken the hoof's defenses, things like laminitis, for instance, or endocrine disorders, Cushing's disease, which is PPID, or equine metabolic syndrome, EMS.
And nutrition.
Poor nutrition can definitely impact hoof quality and resistance. So yes, if you're seeing abscess after abscess, it's time to look beyond the foot and investigate the horse's overall metabolic and nutritional status.
Okay, let's shift to spotting the signs. You mentioned that dramatic, sudden lameness. Sound one day, crippled the next.
That's the classic presentation. Acute onset, often non-weight-bearing lameness. The horse might have been perfectly fine the evening before.
But it's not always that severe.
No, it can vary, and if it goes undiagnosed, the pus can spread, leading to more chronic, grumbling pain. In those longer-standing cases, you might see swelling creeping up the leg.
Higher up.
Yeah, into the pastern, sometimes even the fetlock, or higher, depending on how things track. But again, that rapid pain relief once you get drainage, that's your key indicator. It reinforces that pressure is the main villain.
So when you examine the hoof itself, what are the local clues you look for?
First thing is heat. You'll often feel noticeable heat in the hoof capsule compared to the others.
And the pulse.
The digital pulse, yes.
Yeah.
Felt usually in the pastern area, it becomes stronger, more prominent, often described as bounding. That's a very consistent and highly indicative sign of inflammation in the foot.
Okay, heat and pulse. What else?
You might see swelling, specifically around the coronary band or the heel bulbs, sometimes general lower leg swelling too. Pain on hoof testers is a big one.
Those pincers the vet uses.
Exactly. Applying pressure helps pinpoint the sore spot. If it's already burst, you might see the drainage tract, maybe some discharge, sometimes a nasty smell. And the horse will likely adopt a pain-relieving stance, resting that foot.
Those are all local signs focused on the foot and lower leg.
Yeah.
When should you worry about it being more systemic?
That's a critical question. If you see signs beyond the leg like a fever, the horse going off its feet, acting depressed or generally unwell, those are red flags.
Why?
It suggests the infection might have spread beyond the hoof capsule, or that the horse's overall system is struggling to cope. That requires a much broader diagnostic look and potentially different treatment.
Right. So assuming it looks like a standard abscess, how does the vet confirm it and find the exact spot?
It starts with that hands-on exam, feeling for heat, carefully checking those digital pulses. Then come the hoof testers.
Applying pressure to map out the pain.
Precisely. A positive, focused reaction in one area guides us. But interpreting them takes experience.
How so?
Well, a thick-soled, heavy-walled horse might not react much, even with an abscess. Conversely, a thin-soled horse might be sensitive all over, even without one. You're looking for that specific, repeatable sore spot.
Once you've narrowed it down, what's the next move?
Careful cleaning of the hoof is essential. Then, using a hoof knife, the vet or farrier will carefully pare away the sole horn in the suspect area, searching for the tract.
Just digging in.
No, it's meticulous. The goal is the smallest possible opening that will allow drainage. You don't want to create a huge wound.
What if you can't find it right away?
That happens. In that case, poulticing is often the next step. Apply a wet, warm poultice like Animal Intex soaked in warm water, maybe with Epsom salts, bandage it up, and leave it for 24, maybe 48 hours.
What does that do?
It helps soften the horn and encourages the abscess to mature, to draw closer to the surface, making it easier to locate and drain later.
This brings up something really important you mentioned earlier, finding a nail or sharp object in the foot. The instinct is pull it out immediately.
Everyone wants to. But medically, the advice is firm. Leave it in until the vet sees it.
Why? Seems counterintuitive.
Because leaving it allows for accurate x-rays with the object in situ. Seeing exactly where that object went, how deep, what structures it might have hit, that information is absolutely vital.
It tells you if it hit bone or tendons.
Exactly. It dictates the treatment plan, the potential need for surgery, and significantly impacts the prognosis. Pulling it out erases that crucial evidence.
Okay, so x-rays are important, especially with potential foreign bodies. Do they actually show the abscess itself?
Usually not. For a simple acute abscess, the pus itself isn't typically visible on an X-ray, unless
Unless.
unless the bacteria involved produce gas. Then you might see a little dark area, a gas shadow, on the film,
So why take X-rays if they don't usually show the abscess?
primarily to rule out other things. X-rays are invaluable for checking for coffin bone fractures, navicular bone issues, or identifying a sequestrum that's a piece of dead infected bone, things that cause similar severe lameness.
Got it. Ruling out the really bad stuff. What about more advanced imaging like MRI?
Ah, MRI. That's the gold standard for foot lameness. It gives incredible detail of both bone and soft tissues.
So it can see the infection.
Oh, yes. MRI can pinpoint the exact location of the infection, show inflammation, any deep draining tracts, and identify if deeper structures are involved, like the deep digital flexor tendon, or if there's bone infection, osteomyelitis.
That sounds like a game changer for complex cases.
It absolutely is. Going from X-ray findings to MRI findings can drastically shift the prognosis. If MRI shows involvement of tendons or bone, you're moving from a generally good prognosis for a simple abscess to guarded or even poor.
It really puts things in perspective. You hear fracture, laminitis, tendon infection, and suddenly hearing it's an abscess feels like dodging a bullet. Vets calling it the best finding.
It sounds strange given the pain, right? But compared to those other possibilities, an uncomplicated abscess is usually straightforward to manage and typically resolves without long-term consequences. A fracture or severe laminitis, that's a whole different ballgame. So yes, in a lameness workup, finding just an abscess can be a huge relief.
Okay, relief it is. So diagnosis confirmed, location pinpointed. The main treatment goal is
Drainage, drainage, drainage. Establishing that pathway for the pus to escape is number one. That meticulous pairing to create a small but sufficient opening.
and the relief is usually fast.
Often immediate and profound, yes, as soon as that pressure is gone. But again, the key is not overdoing the pairing. Making the hole too big can cause problems.
Like what?
It can slow healing, or worse, allow the sensitive inner tissues, the corium, to bulge out of prolapse. That's painful and complicates recovery significantly.
Okay, small hole, big relief. What comes after the draining? What's the follow-up care?
Supportive therapy is key. Soaking the foot in warm water with Epsom salts, maybe a 4-to-1 water to salt ratio, helps draw out any remaining infection.
How often?
Usually once or twice a day for a few days. Then poulticing, applying something like animal Intex or a sugardine mixture, sugar and betadine, under a bandage.
What does the poultice do?
It continues to draw out exudate, keeps the area clean, and provides some padding. But here's that balance again.
With moisture.
Exactly. Therapeutic soaking is good, but prolonged wetness isn't. So after soaking and poulticing, you need effective bandaging to keep the site clean and relatively dry between treatments. Vet wrap, duct tape, maybe a hoof boot, or even a disposable diaper can work well.
Keeping it clean and protected is vital. What about the environment?
Needs to be clean and dry. Standing in mud or manure is asking for trouble, and some controlled movement, like hand walking once the initial pain subsides, can actually help pump out remaining fluid.
And pain relief meds. NSAIDs like bute.
Yes, drugs like phenylbutazone, bute, or flunixin meglumine, Banamine, are commonly used to manage pain and inflammation, especially while you're still poulticing and waiting for everything to settle down.
But they might not work great before drainage.
They might take the edge off, but they often struggle against that intense physical pressure. Drainage is the real pain reliever.
Now the antibiotic question again. Bacterial infection. But usually no antibiotics. Still seems odd.
It does feel counterintuitive, doesn't it? But for your typical uncomplicated abscess confined to the hoof capsule, systemic antibiotics generally aren't needed or even helpful.
Why not?
Two main reasons. One, getting good antibiotic concentrations way down inside the hoof capsule is difficult. Two, there's some thought they might actually slow down the natural process of the abscess maturing and wanting to drain. They can kind of trap the infection sometimes.
So when are antibiotics used?
They're reserved for cases where the infection has clearly spread deeper, involving tendons, joints, or bone, osteomyelitis, or if the horse is showing those systemic signs of illness we talked about.
But one thing you always need, regardless of antibiotics.
Tetanus protection, absolutely non-negotiable.
Why is so critical for hoof issues?
Because puncture wounds in the hoof create the perfect anaerobic environment, no oxygen, which is exactly what Clostridium tetani, the bacteria causing tetanus, loves. If the horse's vaccination isn't up to date, a booster or tetanus antitoxin is essential. It's a life-saving precaution.
Makes sense. Now, for those nasty, complicated cases where maybe bone is involved, Are there surgical options?
Yes. If infection reaches the coffin bone, causing osteomyelitis or forming a sequestrum, simply draining the sole isn't enough. You often need more aggressive surgical debridement.
What does that involve?
It might mean removing a section of the hoof wall, a hoof wall resection, to get direct access to the infected bone to clean it out thoroughly. Sometimes drains are placed.
You mentioned maggots.
Yes, medical maggot therapy. It sounds gruesome, but sterile, specially raised maggots are incredibly effective in some chronic or complex wounds. They selectively eat away only the dead, untouched. It's precise biological debridement.
Wow. Okay. Nature's little surgeons.
Yes.
So, moving towards the end game. Prognosis. What's the outlook usually?
For uncomplicated abscesses, it's generally very good. The key is seeing that significant improvement within 12 to 24 hours after drainage. That's your 24-hour rule.
And if they don't improve that quickly?
That's a red flag. It suggests it might be a more complicated abscess involving deeper structures, the drainage might be inadequate, or potentially it wasn't an abscess to begin with, maybe a fracture was missed.
How long does full recovery take?
It varies. A simple, superficial one might be resolved in less than a week. Deeper ones can take several weeks for the tissues to heal properly.
Are there common complications to watch for?
Recurrence is one possibility. Deeper issues like infections spreading to the flexor tendon sheath or that coffin bone infection, osteomyelitis, or sequestrum formation, those are serious. Laminitis can be a complication, or sometimes an abscess can be secondary to laminitis.
That bidirectional link you mentioned.
Exactly. And the iatrogenic one caused by treatment is that prolapse of the sensitive tissues if the drainage hole was made too large. That really delays healing.
But assuming no complications, the horse can get back to full work.
Yes, the long-term outlook for function after an uncomplicated abscess is excellent. However, that defect in the sole or wall, where it drained or where surgery occurred, needs time to heal and grow out. It remains a potential weak spot until solid new horn replaces it.
How long does that take?
A hole in the sole fills relatively quickly, but if there was hoof wall removal, that has to grow down from the coronary band, which can take months, even up to a year for a large defect.
So prevention is clearly better than cure. What's the strategy? Seems like it involves multiple fronts.
It's definitely a comprehensive approach. The absolute foundation is good, regular hoof care by a skilled farrier.
Keeping them balanced, trimmed properly.
Exactly. Addressing any flares, cracks, or imbalances reduces those potential entry points for bacteria and minimizes abnormal stresses on the foot.
And the environment. We talked about wet and dry.
Crucial. Keep their living area as clean and dry as reasonably possible. Regular manure removal from stalls and paddocks. Avoid forcing them to stand for prolonged periods in deep mud or stagnant water.
What about those extreme weather shifts?
Try to manage the transition. Some people find applying hoof hardeners before a very wet spell or hoof moisturizers during a very dry spell can help maintain the hoof's integrity. And just basic paddock safety checking for and removing sharp rocks, wire, construction debris, avoiding unnecessarily hazardous terrain.
Makes sense. What about internal factors? Nutrition.
Hugely important for hoof health. A balanced diet, primarily based on good quality forage, is key. Specific nutrients are vital for horn quality. Biotin, zinc, methionine are the well-known ones.
So supplements can help?
They can if there's a deficiency or if the horse needs extra support for hoof growth. Poor overall nutrition definitely contributes to weak, abscess-prone hooves. It reflects their whole systemic health.
Any other factors?
Regular exercise is beneficial too. It stimulates blood flow within the hoof, which is essential for healthy tissue growth and maintenance.
Okay, let's wrap this up. Our deep dive shows equine solar abscesses are common. They cause that really sharp, scary pain. But thankfully, most are manageable if caught and treated promptly.
That's the key takeaway. And remembering that the intense pain is primarily due to that unrelenting pressure inside the hoof capsule. That's why establishing drainage is the #1 treatment priority.
Right. We also saw that while many are simple punctures or cracks, the causes are diverse environment, underlying hoof quality, even systemic health issues can play a role. Getting an accurate diagnosis, sometimes needing X-rays or MRI, is vital to rule out more serious problems.
And treatment focuses on that drainage, followed by careful cleaning, soaking, poulticing, and bandaging. Antibiotics are generally reserved for the complicated cases, but tetanus protection is always a must.
The outlook is good for most, but watching for complications is important, and prevention isn't just one thing. It's good farriery, managing the environment, sound nutrition, and regular exercise, all working together.
Exactly, a holistic approach.
So for you listening, what does this all mean? It means knowledge is power. Understanding abscesses helps you spot them early, get the right help quickly, and take proactive steps to prevent them, keeping your horse sound and comfortable.
And perhaps a final thought to leave you with. If the hoof can be such a sensitive indicator, reflecting everything from ground conditions to metabolic disease, what else might we learn by paying close attention to hoof health? Could recurring issues be pointing towards even subtler systemic imbalances that we don't fully understand yet? What other local problems might actually be whispers from the body's deeper systems?